Serving 875,000 people, Island Health's focus is the health and wellness of the residents and communities on Vancouver Island and in surrounding coastal communities. Our diverse geography spans 48 settler communities and 50 First Nations, from the Zawadenu people of Kincombe Inlet to Victoria, from Tofino to Comox. We acknowledge with respect and gratitude our privilege to provide health and care services on the traditional unceded territories of the Coast Salish, Kwakwaka'wakw, and Nuu-chah-nulth cultural families. The Island Health family includes 27,000 healthcare professionals and 1,000 dedicated volunteers. 2,900 doctors, nurse practitioners, midwives, and dentists make up our medical staff. We provide health and care services at 145 facilities, with more than 6,600 long-term care beds, nearly 1,400 mental health and substance use beds, and more than 1,800 acute care and rehabilitation beds. Island Health has an annual budget of $3 billion. Each year, this funding supports 491,000 visits to emergency departments, more than 73,000 surgeries, 59,000 MRIs, 152,000 CT scans, 2,100 telehealth visits, more than 51,000 visits to urgent and primary care centers, over 16,000 home health monitoring visits, and 463,000 home health care visits each year. Island Health has expanded our primary care services with 7 Island Health urgent and primary care centers, and we partner in 3 community health centers and 7 primary care networks across the region, with further expansion in the works. Under the leadership of 6 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 600 inspections of licensed care facilities, and 4,500 inspections of food service operations. Public health nurses provide more than 5,000 perinatal home care visits, and in partnership with First Nations Health Authority and community pharmacies, more than 2 million COVID vaccines have been provided in Island Health. From before birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
Good afternoon. I'm Leah Hollins, the board chair for Island Health. We're really pleased to see you here this afternoon, and on behalf of my colleagues, welcome to our public forum. I acknowledge that we are on the occupied, unceded traditional Cowichan territory that consists of the Shannon, Halalt, Liaxon, and Cowichan Tribes First Nations. The House of Friendship Center and the Cowichan Valley Métis are people who we also honor and with whom we appreciate our working relationship. Earlier today, over lunch, we had a wonderful welcome from Elder Ray Charlie. And unfortunately, he's not here at the moment, but he started off our day in a very good way. I acknowledge with respect and gratitude that Island Health provides care on the lands of the Coast Salish, Nuu-chah-nulth, and Kwakwaka'wakw cultural families. We also recognize the Malahat, Dididat, and Lake Cowichan First Nations, as well as Métis, Inuit, and other Indigenous people across Canada. We do this to reaffirm our commitment and responsibility to improving relationships between nations and to cultivating our own understanding of Indigenous peoples and cultures. Please join me in reflecting on the harms done to Indigenous people, such as the cultural genocide and assimilation of Indigenous peoples, the residential school system and recovery of graves of Indigenous children, including those at Kuper Island Indian Residential School, the too many missing and murdered Indigenous women and children, and the social inequalities and racism that exist today. I invite you to think about the responsibility we each have to act in a spirit of reconciliation, healing, and collaboration. Public forums provide an opportunity for the board to meet the people and communities we serve and are an important part of our commitment to transparency and accessibility. I'm hoping our time today together will help us to better see what matters to most of you so that we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. We are all appointed by the Minister of Health, but the reason we choose to sit on the board is because we care deeply. As a former nurse, Deputy Minister of Health, and Chair of Canadian Blood Services, one thing that has always been central to my work is the patient. I always ask myself, is what I am doing right for the patient? Because caring for the patient is why I started working in healthcare and why I continue to support the delivery of health and care. Caring is also why every member of the Island Health family are dedicated to delivering Island Health's vision of delivering excellent health and care for everyone, everywhere, every time. It's now my pleasure to introduce you to our directors who are responsible for the overall direction of Island Health. The board consists normally of 10, so we're short one board member at the moment, but 9 directors appointed by the Minister of Health. In addition to me, the chair, the board includes Ron Rice, a member of the Cowichan Tribes who lives in Victoria, Shawnee Cassavant, who unfortunately isn't able to be here today, but she is from Hupatchesat and Seychot First Nations on the West Coast, Vivian Hermanson from Campbell River, Diane Brennan from Nanaimo, Ann Davis from the Comox Valley, and unfortunately Ron Matson from View Royal isn't able to be with us either today, Ann McFarlane from Saanich, but it says Victoria, but she's actually from Saanich, and Alana Nast from Victoria. Thank you. We also have members of our local leadership team and our executive management team joining us this afternoon. And now I'd ask them to let you know somehow that they are in the room by giving you a wave. So just take a minute to look around and see who they are. You will hear from some of them later this afternoon. We have a very full program today. Island Health's President and CEO, Kathy MacNeil, will begin by providing an update on the delivery of health and care services across Vancouver Island, and particularly here in the Cowichan Valley. Dr. Shannon Waters, Medical Health Officer for the Cowichan Valley, will speak about public health and wellness in the region. We will then have a presentation from regional staff on some of the key services available to support people in the Cowichan Valley. The last part of the agenda will be an opportunity for you, community members who have come to this meeting, to ask questions so that we can hear from you. We are also live streaming this in-person meeting for those who could not make it here today. We asked those folks to send in questions in advance by email, and we will do our best to address those questions in our presentations and the question and answer period as well. This meeting is going to go until 2:30, and we've got a pretty tight schedule, so I'm going to be pretty strict about making sure that we finish on time. And now I'd like to invite Kathy MacNeil, Island Health's President and CEO, to open with an update.
Thank you, Leah, and good afternoon, everyone. With respect and gratitude, I too would like to acknowledge the wisdom, culture, and traditions of the Penelakut tribe, on whose territory we are gathering here today. We heard from Elder Ray Charlie earlier today that the longhouses of Penelakut tribe were located on these lands that we meet on today. And at the time of those longhouses, there were 11,000 members of Penelakut tribe. And after the gifts that they received from the Canadian government of blankets infected with smallpox, that tribe reduced to 200 people. Today, the good news is they're back up to 1,000. But we hold that experience deeply as we do the work around eradicating racism in the experience of healthcare. And it was so powerful to hear from Elder Ray the significance of our meeting here on these lands. We acknowledge that Indigenous peoples' relationship to the lands and waters is of critical importance to health and wellness. We also recognize the importance of their customs, values, and traditions as we continue to work towards creating a culturally safe health system with respect and with humility. I want to take a moment to remember and honor those who attended or did not return home from the Cooper Island Residential School and the other residential schools across the traditional territories we live upon and we serve. We are committed to making major systemic changes within our organization as we continue our journey of reconciliation. We've made cultural safety and humility a top priority, and we've implemented changes at the organizational level. In support of this work, I want to thank and acknowledge the Cowichan Primary Care Network, who've established a community of practice for providers who care for Indigenous people in primary care. The healthcare leaders here in Cowichan Valley have also developed their community of practice to foster a better understanding of systemic Indigenous-specific racism, putting recommendations from the in plain sight and paddling together reports into action, starting at the leadership level. In the first few months of coming together, this team has explored firsthand accounts of residential school survivors. This led to participants coming to terms with residential school history that they had previously been unaware of and brought these experiences closer to their home and also to their work. They've reflected on the Remembering Keegan report and the recommendations about Keegan's care, with small and large group discussions on actions they can take now within their spheres of influence to address gaps which could result, and we want to prevent, similar tragedies. They've also participated in a sharing circle to share their own experiences within healthcare and the innovative work they are doing in their communities. This circle includes Cheryl Sampson of the Chemainus First Nation and Jennifer Jones, the former health director of Chemainus Health Center and member of the Liaxin First Nation. And I'm so pleased to say that Jennifer has just joined our team at Island Health as a manager for Indigenous health in this region. And Jennifer is here with us today. So welcome, Jennifer, to the team. We know there's a lot of work to do when it comes to reconciliation, and we are only at the beginning of a very long journey, and every step, big or small, is a step towards acknowledgement, understanding, and change. Today, we're so delighted to be with you here in person in Chemainus. It's so nice to be able to be together, finally. It's wonderful to see some familiar faces who we've worked with over the years, and some new faces as well. Everyone in this room plays a role in helping deliver upon a vision of excellent health and care for everyone, everywhere, every time. I look forward to sharing some of the work underway here in Chemainus, Ladysmith, and the Cowichan Valley. We had the great pleasure earlier today of seeing some of that work firsthand as we toured the Ladysmith Community Health Center, and here in Chemainus, the Health Center, with the board members and some of our executive team. And I think I can speak for many of us to say how impressed and impacted we were to see the caring in these small urgent care centers. You're so lucky to have these in your communities. Some of the larger communities would really look to you to say, love to have that kind of caring available to them in the teams and how they really own the responsibility of delivering healthcare here locally. As a health and care provider, we face a dual challenge of meeting today's needs and trying to plan and prepare for the future. I'm going to talk a little bit about our long-term vision and the work ahead in the coming years to help us achieve that vision. And I also want to acknowledge right up front that we are mindful of the current challenges that we have today in delivering healthcare services. We're trying to hold that work of today and tomorrow at the same time. Recognizing the challenges, we've identified 8 organizational-wide priorities for this year. The first one you've heard about already, cultural safety and humility. The second priority is a focus on access to priority services, services like mental health substance use, emergency department services, long-term care, surgery services. A focus on patient safety and practice standards. A focus on staff safety and wellness culture. A focus on health human resources, which I'll talk about a little bit more in a minute. A focus on innovation and what we're calling right care, right place. A continued focus on the COVID response and recovery and climate change. And another focus on addressing the ongoing drug toxicity crisis. At the very beginning of 2020, before we heard about a pandemic, we launched our strategic framework, laying out our destination over the next 5 years. Little did we know what was about to hit us over the next 2 years. Now with our COVID work becoming more normalized, we're looking closely at our strategic framework and incorporating the lessons that we've learned throughout this pandemic, and there have been many. While we're working hard to continue advancing our long-term goals, we know we have a lot more to do. We are constantly learning on this journey, and we're making the best use of the resources we have. Through the pandemic, we learned new ways of working together. The partnerships that have been formed and strengthened during this time are extraordinary. We built bridges with local governments, with primary care providers, with Indigenous partners and others, disrupting traditional patterns and working together in new ways. Here in the Cowichan Valley, we work closely with all of our community partners, including the Cowichan Valley Division of Family Practice, our Cowichan Community Health Network, the Cowichan District Hospital Medical Society, the Cowichan District Hospital Foundation, several hospital auxiliaries operating in the Cowichan Valley, including the Chemainus Healthcare Auxiliary, and of course, our many First Nations partners who we've mentioned earlier. Coming out of the pandemic, we are facing significant challenges, not unlike other healthcare organizations in British Columbia, in Canada, and actually in the globe. Front and center for all of us is the sustainability of our people, our workforce. We're nothing without our people. And our people are tired and depleted after this experience of pandemic. 2 years of constantly being on response, on top of pre-existing staffing and structural challenges, have been enormously taxing on everyone in the health system. Many of you in this room, and some folks watching online, have worked tirelessly to sustain us and provide care to patients, help us provide care to patients, and I want to thank you for your hard work. In response to our staffing challenges, we launched our Health Human Resource Sustainability Initiative. This work is a key priority for the next year and beyond. There are no quick fixes to this problem. We have a dedicated team plus people at all levels of the organization, prioritizing the work in 5 key areas: flexible work arrangements, great leadership, creating learning and career pathways for people, flexible and adaptive care models, and ensuring that we have a competitive talent program. Here in the Cowichan Valley, we've been holding weekly sessions to support leaders in working with available resources to help them and their teams adapt and innovate where care conditions change. And we launched a competitive talent strategy at Cowichan District Hospital in April. We're working towards flexible self-scheduling at the hospital emergency department as we start recruitment efforts for the workforce at the new hospital. And like all other healthcare organizations in BC and around the world, our organizational and HR challenges are significant. And just as it's taken years to get to where we are, it's going to take some time to resolve them. We are committed to our people. We're putting resources towards this important work, which often requires us to think differently about how we organize and deliver other services. A good example of the changes we're making in the organization to better our services happened just last week at Cowichan District Hospital. Last week, staff at the hospital transitioned from using paper charts to using electronic clinical documentation as part of the continuing move to electronic health records across this region. This change will improve the quality of care we provide to the people in this community. Instead of a patient history buried in health records and old handwritten notes, the electronic record provides a clear, documented, continuous record available in real time to teams of healthcare professionals across sites and departments. And we heard this morning from Dr. Tanis Morris how important these tools are to this community, begging us to also include the Chemainus Urgent Care Center as a site to use these electronic tools. What I've heard from colleagues at the hospital is that this change inspires them to advance further. They're now looking forward to adding more advanced functions of the electronic health record because they can see how this can positively affect quality and consistency of care for their patients. So given all that excitement, I also want to acknowledge that in order to make such a significant change, it took a lot of work on many, many people's parts. The site worked hard to lower the volume occupancy of patients so that people could have the time to implement this change in their practice. I want to acknowledge the site for their hard work and also thank Community Health Services here in Cowichan Valley for stepping up to help reduce occupancy in the hospital, creating less demand on the physicians and the nurses and other staff in order to allow them to have some time for learning and implement this change more effectively. We know both pre- and post-pandemic, this community has faced many healthcare challenges. One of the biggest challenges here in the Valley and across the province is mental health and substance use. We are working to bring more resources to the Cowichan Valley and have made improvements to mental health and substance use services. We've made enhancements to the Assertive Community Team, or ACT team, in the Valley, which allows us to provide services to people in smaller surrounding areas. In Duncan, a new ACT team has been implemented, which bolstered the existing team. This team is made up of 10 full-time nurses, social workers, peer workers, psychiatric rehab workers, and others who work as a multidisciplinary team to deliver complex mental health and substance use treatment, rehabilitation, and support services to clients. The enhancements to all of the outreach teams over the past couple of years have provided greater opportunity to cover the areas from the top of the Malahat to Chemainus, Ladysmith, and the surrounding region. The partnership with local services, including police, has allowed us to provide mental health supports in smaller communities that may not have had the same infrastructure as some of the larger cities. An integrated outreach response team supports people who are unhoused in North Cowichan and Duncan, providing nursing services, harm reduction supplies, crisis response, and facilitates access to treatment and other mental health services. We're also working with Warmland Shelter in Duncan to fund 6 sobering and assessment beds. Access to mental health, substance use, whether it's counseling or psychiatry, is available to all the people who reside in the Cowichan Valley. It's available in person, located in Duncan, or through virtual appointments for those who are unable to travel. We know there's much more to do and are continually working on bolstering the supports and services in the Valley. Another challenge in this community, this is a good problem to have, is a growing population, which will lead to an increase in demand for care. We're getting close to announcing a significant milestone on the new Cowichan District Hospital, which will meet the healthcare needs of people all across the Cowichan Valley. We're currently wrapping up the procurement phase of the project and will shortly be starting on design and construction phase. The project team is working with the proponent to prepare for the next phase and is looking forward to engaging with Mayor and Council and the broader community as we prepare for groundbreaking. While we know building a new hospital has been long awaited, our efforts to optimize this new facility must be paired with investments in the community. We have learned this lesson. If we don't support community services when we build a new hospital, the new hospital will not be optimized. In 2018, we commissioned the Cowichan Valley Health and Care Plan, a sister project to the Cowichan District Hospital Replacement Project. The plan launched in April of 2021, and since that time, a range of supports and care have been implemented. Palliative care enhancement and 24/7 support for end-of-life care in people's homes. Short-term enablement and planning suites at the Meadows Assisted Living to support transition out of hospital. This initiative received national recognition as a 3M Healthcare Quality Award this past May. Outreach to clients with substance use issues, including access to a physician for primary care treatment. This strategy resulted in a 70% reduction in emergency room presentations within this client group. We're also leveraging our virtual services to help connect people to care. Our virtual care connects patients to healthcare providers and information. It includes video appointments, appointment booking, secure messaging, and access to some test results. Virtual care supports most clinical programs to ensure that people have access to care delivered through a range of solutions, including virtual visits and remote patient monitoring. We've expanded those virtual services to 12 days a week, 7 days a week, 12 hours a day. Some weeks it feels like there's 12 days a week. We're also expanding our virtual palliative support care into the Cowichan Valley. We will keep working and adapting along with our community partners and our staff to make sure patients have access to care. We will also continue working in partnership with area First Nations, Indigenous organizations, our partners at First Nations Health Authority, and local leadership to ensure the services we provide are delivered in a culturally safe and respectful manner, so Indigenous patients and their families always feel welcomed, heard, and supported. Our vision and values continue to be our guiding force through the difficulties we face. We return to them again and again during COVID, especially when we were in times of uncertainty and didn't have a clear roadmap. Returning to the basics, our vision of excellent health and care for everyone, everywhere, every time got us through. The only road ahead to achieving these results is the one we walk together, across silos and departments inside our organization and across organizations, because we are all in service to the people who need us. We're committed to the vision we hold, despite the challenges, and we will continue to provide safe and reliable care. Our incredible teams are dedicated to caring for this community and to rising to the challenges before them. It's our job to stand beside them, hold them up, and support them in this work. Thank you for being here today and for and thank you for letting us share the work we're doing here in your community.
Thank you very much, Kathy. I mentioned earlier that we were going to have a presentation from Dr. Shannon Waters, the Medical Health Officer for the Cowichan Valley. So over to you, Shannon.
Hi, Chgalia, Ait Scoil, and Shannon Waters, I Quanasi Lamnala. Good day. My name is Shannon Waters, and it's really nice to see all of you. I also want to acknowledge the territory of the Penelachach people. I myself am a Hulkamitnam, a member of Chemainus First Nation, and have a lot of family ties to Cowichan tribes as well. And so it's an honor and privilege and challenge being a medical health officer with Island Health within my own home territory. And while sharing a few words with you here today, I'm really honored to have two amazing women I work with, Vanessa, who's behind a speaker here, and Cindy, and we're going to be talking about how we're doing in the Cowichan Valley and some of the ways we're approaching how to try and address this together. So it's been mentioned, and you can't have really a conversation about health without mentioning what we've all gone through collectively in the last number of years with regards to COVID. And I'm not going to talk about COVID itself. I'm going to talk about how we're coming out of this together and what we need to do to recover. So some of you may have taken part in some surveys that were called SPEAK for short, SPEAK surveys. There was 2 of them throughout the time of the pandemic. And there we gathered some information about how this was affecting us, the virus itself, and also the measures that were in place for us to help try and decrease the spread of what was going around. And this data here I'm starting with is very specific. So I'm going to start with specific data for Cowichan Valley North, which is the region we're in right now. And I'll also share a bit of data for the whole of the Cowichan Valley region and then for Island Health as a whole. So I want to preface this data here by saying, hands down, and through the Chronic Disease Registry at the BC Ministry of Health, mood and anxiety disorders already had the highest rate of incidence for conditions within this region. And it's really not different from other regions across Island Health and across the province. But what we went through collectively through COVID affected that. So what we found, compared to before the pandemic, is that Cowichan Valley North residents reported increased stress and alcohol consumption, feeling helpless, worsening mental health, less connections with friends, and a weaker sense of community belonging. And this is already when mood and anxiety disorders are our highest burden. But particularly, and I want to note that this survey didn't ask questions of children, but for people who were living with children, they reported that the children also had increased stress, increased screen time, and less connection with friends. So what I think this shows is we have a real challenge collectively about how to support our mental, emotional, spiritual health, and that we, this is a real area of focus. And in the next slide, I'll also highlight that this mental health concerns are, in addition to another crisis we have found ourselves collectively here in the province and across the country over the last number of years, and that's the illicit drug toxicity crisis. So this here is a very sobering slide. I want to acknowledge that some of these numbers might reflect individuals that lived in a home with you, friends or loved ones, and I just really want to just take that time to acknowledge that these numbers affect all of us who are here today. This shows the numbers of deaths we've had related to the drug toxicity crisis from 2015 till 2022. You can see there's a bit of variability over those years, which is not unusual in an area with a smaller population. But what you can really see since 2020, since the pandemic, is we've had consistently high numbers from 28 deaths in 2020 31 deaths in 2021, and so far until August 31st of this year, 27 deaths due to the drug poisoning crisis. What I also want to say is this averages out to about 3 deaths in our region a month. And the highest, the age group with the highest rate of these deaths is in the 25 to 44-year-old age group. So this is affecting people in our community at the prime of their lives, and it's affecting the families, their loved ones, and all of us living here. Next slide. And I also want to comment on another crisis we're collectively going through, that of what's going on with our climate. I have 3 depictions here. I'll start with the one on the right. We've had collective experiences of a lot of wildfire smoke here in our region, across the province. We do have a bit of wildfire smoke coming over from Washington in the last number of days. And this here shows how dispensations getting Ventolin, or what's called salbutamol, from a pharmacy is affected by, so that's the bottom line with the spike, by the top line with the red bars, by what's going on with our air quality. So the bottom line with the spike shows a particular time in August of 2019 when we had a large amount of smoke in our community. And the red bars indicate that the number of people who were filling out prescriptions for salbutamol was way above what we would normally predict. So this is how we're collectively experiencing the collective impacts on our health from forest fire seasons that are becoming more frequent and more severe. At the bottom right here, I want to acknowledge that this is a map showing some of the impact of the heat dome that occurred last summer. And there's small orange circles which show the number of deaths and where they occurred. And I want to acknowledge here in the central Vancouver Island region, we had 25 deaths during that 5-day time period. So this is very much something. I don't think any of us had experienced temperatures above 40 degrees Celsius in the place we call home. It had impact not only for humans, but for our plant relatives and our animal relatives as well. And lastly, I'm just going to mention drought. And I leave this to last because we are still in stage 4 drought today, well into the fall of 2022. And this has impacts on our plant and animal relatives. It also has impacts on people whose lives are affiliated with their livelihoods are affiliated with water. It affects our food security. One of our livelihoods in this land for generations upon generations, salmon. Like, is there going to be rivers for them to swim in? But also very fundamentally as well, it can affect our drinking water supply. And so last year we did a survey of drinking water system operators here on the island, and we found that already in a place known for wet walks and water-loving forests, we have had 16% of our water system operators already having experienced water shortages. And I think this is something we need to very much prepare for in times coming ahead. So with that, I'm going to welcome my friend to share a bit with you here today. And specifically, in hearing these types of, data about how we're doing, it can be overwhelming. But also at the same time, we're here today to talk about some of the ways we can work together to support our people and also to respond in a collective way. And one of the ways that we can do that is through having good data about where we should put our priorities and our focus. So the data I've just shared with you here today gives you some ideas of where I think we should place our priority and focus, but we're also looking at an opportunity to ask our community members what their experience is like the Speak survey, and get more defined data for where we should move forward together. So with that, I'll ask Vanessa to share a bit about this exciting work called Our Health, Our Community.
Wonderful, thank you. Thank you, everyone, and thank you, Dr. Waters, for the introduction. My name is Vanessa Data, and I'm really honored here to stand here with my colleagues, Dr. Waters and Cindy Lise, to talk about this amazing new project we have for our community, Our Health, Our Community. But first, before getting into the logistics of the project, I just would like to extend my gratitude to Island Health's executive team, board of directors, the region's medical directors, and esteemed elders and First Nation leaders for the opportunity to speak with you today about this project. In the next about 5 minutes, I hope to provide some brief insights into the survey's purpose, goals, and proposed impacts for the community. So next slide, please. So first off, what is this survey? The intent of this survey is to collaboratively design a Cowichan Valley-specific health and wellness survey to capture local data on the health and well-being of residents. The goal is to produce data surrounding the 12 determinants of health and health inequities, so those variables such as income, social status, our physical environments, access to services, all of these variables that contribute and influence the health of an individual and a community. And our project itself is really founded upon the principles of community-based research, where all stakeholders, including those who stand to be impacted by the survey results, will be engaged and invited to contribute to the design of this survey. Our team hopes to work in consultation with our broader community to develop the survey's questions and processes so that they're really specific to the region and our needs here. And so the survey will launch in the spring of 2023. It'll be open to residents 18 years and above, and we're hoping to recruit 4,500 survey respondents, setting quotas for demographics around geography, age, sex, education, income, and ethnicity to ensure that we're getting a truly representative sample. The survey instrument itself will be delivered both online and in print to ensure the survey is accessible to diverse communities, and those who have been underrepresented in previous surveys will have access to contribute their voice and experience to the survey. Next slide, please. So what value does this bring to the Cowichan Valley? The project proposes to support the health of our community through identifying and examining local health status, health inequities, modifiable risk factors, and community strengths, which will allow us to make associations between determinants of health and health status, to identify and inform community planning, public policy, resource allocation, as well as to inform funding applications. And it's our goal for the survey to produce timely, again, local data for community members, service providers, and health practitioners so that they have the quality information they need to guide health policy, best practices, and services for our community. Next slide, please. So who's involved? At the heart of this project is a collaboration. So this is a partnership between our Cowichan Communities Health Network, the Cowichan Valley Regional District, and Island Health. And we're currently working to engage with our Indigenous communities to invite further partnership development. As it stands now, the project team consists of 3 stakeholder groups. We have our advisory team, and we meet weekly to move the vision forward of the project, as well as to provide oversight and quality control. We have our working groups that carry forward the day-to-day operations of the project, and then our community advisors. And these advisors are local community organizations in the Cowichan region whose staff and members will be invited to inform both the survey's development, so the specific questions that we're going to ask, as well as its efficacy of our approach. And these organizations will also be instrumental in assisting our team to collect our data in field. So where are we now? We're about a month into this project, so it's very early stages. And so the advisory committee hired the project manager about a month ago, and we've been working over the last few weeks to formalize our advisory committee and working on recruitment for further members. We're also working to set up our working groups, such as our ethics working group, and have been commencing with public outreach and recruitment. Next slide. And what's coming next? So over the next 11 months, we've got a lot to accomplish. Right now, our focus, though, before any decisions are made, is community engagement, making sure that anyone who stands to be impacted or that needs to be engaged in this process is aware that this project is taking place and that we're providing an opportunity to share channels of how individuals and communities can be involved and have their say in how this project is designed and delivered. And so we're working to establish relationships with our community advisors, and we're working to engage our Indigenous leaders to invite them to come walk with us, per se, in designing and delivering this project together. Once community engagement is well underway, we'll commence with our survey development over the winter. Again, as I said, we hope to launch the survey in the spring of 2023. And once we've completed our analysis, we'll conduct our report back in the summer of 2023. So this is a really significant project for our region, and our advisory team is just really excited to have the opportunity for this survey for the community. And to quote, if I may, Dr. Waters from a past meeting, she said that this project is a gift for our community, and the more I work with the project and meet community members who are engaged in this research, I can't help but agree more. So I just would like to say thank you for the opportunity to meet with you today and speak, and I'll pass the microphone back to Dr. Waters and the chair.
Yeah, and I'll just close by saying one thing. This survey is something that has happened in 2 other health authorities within the province. It hasn't happened within Island Health as of yet. We're the first region that will be implementing this survey, and it is directly because of the relationships that we have in this community, with our community health network, with our First Nations communities, with people who are sitting here in the organizations that we represent. That's exactly the reason that we were chosen to do this type of work, because it's those relationships that is going to really help us get a lot of results, and that we'll really be able to act upon. So I just want to say thank you to all of you as well.
Great, thank you very much. Thanks, Shannon, Cindy, and Vanessa for that. Never underestimate how important public health is to us. It's just incredibly important, and it gets lost sometimes because other things in the healthcare system take it over. We're now going to move to a special presentation on the suite of services in the Cowichan Valley, and our presenters are Dr. Mackie Kimura, Medical Director for the Cowichan Valley, Emma James, Director for the Cowichan Valley, and Dana Leake, Director of Mental Health and Substance Use Operations in the Central Island. So welcome, Mackie, Emma, and Dana.
Thank you, Leah. Good afternoon, ladies and gentlemen, members of the public and distinguished guests. It's both an honor and a pleasure for Dana, Director of Mental Health Substance Use, Dr. Mackie Kimura, Area Medical Director, and myself, Emma James, Area Director, to be speaking with you today in the unceded and still occupied traditional Cowichan territory that consists of Penelakut, Chemainus, Halalt, Layaxon, and Cowichan tribes communities. The 3 of us have worked alongside these nations and the First Nations Health Authority for the past few years, and we acknowledge that within the wider valley that we also have had the honor of serving the Malahat, Subatsik, Didadat, and other First Nations within the community, and we continue to learn and recognize these communities' progressive approaches to development, and most importantly, to community connection. We also want to take a moment to sincerely thank all of you for being here today and for making the health of the valley and the future of your community, our community, your priority. The Cowichan Valley area that we have the privilege to serve extends roughly from McCurdy Road on the Malahat north to Nanaimo Airport, west to Didadat, and includes the island communities on the east side, Penelakut and Thetis. As of 2021, the Cowichan Valley region served approximately 90,000 people, representing roughly 10% of Island Health's total population and about 1.8% of BC's. And in Cowichan, as in many other areas on the island, many people are living longer, and the need for well-planned, well-coordinated, integrated care is absolutely paramount. The storms that we have weathered together over the past few years have been a great test, and within Cowichan, we also know that they have been a great teacher. We have learned through the response to the pandemic, as Dr. Waters was saying, that we are stronger together when we work together, and that we are united in our purpose and our resolve. Evidence tells us that in happy, vibrant communities, there are strong connections that create a sense of belonging. Within Cowichan, for many of us as leaders, physicians, and providers, This sense of belonging is accompanied by a responsibility and accountability to support our fellow members, and most importantly, all of you. Whilst partnerships in our locality have been established and continue to grow over the years, the case for collaborative working has been further strengthened by the experience of the pandemic. Cowichan's response has been nothing short of extraordinary, and the response resting not just on the health authority, but on different parts of our community being able to work together to address the needs and maintain continued provision. As we emerge on the other side, there is a renewed conviction about the benefits of this partnership and a determination to not only keep hold of those relationships, but to continue to foster, advance, and to grow. As we know, no single service or organization can tackle health system issues alone. And over the past few years, we have recognized the benefit of realizing this full potential to be an integrated, accountable system where we think together about the population and we create services to match the life journeys of the people. We know that people don't come in packages. We're not hospital packages ready for delivery at the Cowichan District Hospital. And we're not primary care packages ready for delivery at the GP clinics. We have been working hard and are continuing to move from a fragmented collection of siloed services and build and create a unified, accountable, integrated system for all. Both Mackie and I would like to give you a snapshot and highlight the breadth of the integrated services that we provide.
So this slide, we'd like to take you through this slide to show you a snapshot of what we have. As far as family physicians in the Cowichan Valley, we have 95 or so in 17 different community practices, about 45 specialists. And over the past 2 years, through the primary care network and the attachment clinic, we've attached over 3,000 patients to a primary care provider. The primary care network has recruited 1.8 FTE, so full-time equivalent family physicians, and 9 nurse practitioners to the Valley since it opened.
Thanks, Maggie. And the Cowichan District Hospital Emergency Department, here on the slide, sees on average 90 patients a day, with the highest volume of visits this year being 134. The hospital has 148 funded beds and is approximately admitting about 15 people a day, with the highest being about 24 patients admitted on one day this year.
So the next aspect of this slide, a unique aspect of our suite of services here is the investments that we've had come into the community with the Cowichan Health and Care Plan. This includes a COPD, so chronic obstructive pulmonary disease service, which since starting in December 2021 has seen over 330 new referrals and completed 1,261 visits. We estimate that this service alone has saved an average of 250 bed days this year at the hospital through preventing admissions and facilitating early discharges.
And the 2 urgent care centres at Chemainus and Ladysmith see on average 103 ambulatory and urgent patients a day, which ensures that we see the emergent patients in the hospital and facilitate the right care in the right place.
Next, Cowichan District Hospital offers a suite of medical and, in this slide, surgical services for patients. One achievement that we're all proud of is that despite the postponement of services over the pandemic, we've been able to catch up and exceed surgical expansion volumes, completing an additional 616 more surgeries this year compared to pre-pandemic. Average wait times in CDH also have continued to improve. So we look at the benchmark expectations. They went from 14% better than benchmark pre-pandemic to now 33% better than benchmark this last year.
And another investment, which Kathy highlighted earlier, is just with the health and care plan, has been the establishment of the short-term enablement suites, a 10-bed transitional unit, which has saved approximately 1,256 acute bed days this year. And then home support, the final little jut out on this slide, which is the cornerstone of the care delivery within the Valley. It enables people to remain in their own homes for as long as possible. This is an incredible service that provides nearly 40,000 visits a month to people living in their own homes in the Valley.
So we wanted to take you on a bit of a trip with these slides, if you can advance it to the next. In the middle of this slide, you've seen Phyllis, so an imaginary patient journey, but just to highlight how all these services that we've been kind of naming off to you get integrated. Phyllis, let's say, is a 79-year-old elderly lady who had to come into the emergency department due to difficulty breathing. Sorry, I'm going to lower this. She's seen in the emergency department and treated by the physician who recognizes that she doesn't have a family physician and asks the liaison nurse to refer her to the Cowichan the Health Connect registry. Because she has chronic health conditions, she is identified as a priority for the attachment clinic within the primary care network. Sorry, can you just advance the slide to see the picture that goes with that? Which links her up to a primary care provider who's taking on new patients. So next, she's referred to the COPD service, which is a component of the Cowichan Health and Care Plan, which we've been telling you about. So this plan has identified strategies which can reduce acute hospital visits by providing community-based options that include not only the COPD clinic that Phyllis benefits from, but the seniors outpatient clinic, palliative care overnight teams, and also mental health. And so this is all in anticipation of the opening of the new hospital to create more capacity within the community. So Phyllis, with the COPD project, gets optimized, her medication's optimized with the community pharmacist, has a respiratory therapist who visits her at home, and she gets her COPD care plan revised. The care team then communicates back to her family physician to address some concerns with medication that they've noticed while visiting her at home. Unfortunately, she suffers a fall at home. Her family physician is contacted, however, can't come out to see her at home that day. She's unable to get out. They reach out to the nurse practitioner who's in our priority response team within Community Health Services, who's able to do an urgent home visit that day. Together with a communication with the family physician, they deem that she could possibly have a fracture. They arrange for her to be transported to the urgent care center in Chemainus for a physician assessment, x-ray, and lab work. There, she gets her fracture splinted and gets an urgent referral to surgery. So this is all done without her having to visit the emergency room at Cowichan District Hospital. So let's say a few days later, she's able to have surgery at CDH. Post-operatively, she has some difficulty with her recovery, being more elderly and frail. And her family physician, who has also been able to follow her into the hospital and care for her in hospital, realizes that she's not quite ready to go home and refers her to that STEPS program that we told you about before, the short-term enablement suites for convalescent. So at these, in the STEPS suites, as Kathy highlighted before, we are also quite proud that we've won a National 3M Award this year for this program in the category Best Quality Improvement Initiative within an organization. So this is an innovative partnership with one of our long-term care affiliate sites where patients who are no longer acute, but who require a period of stabilization before being discharged, or people in the community who need a transitional stay to avoid hospitalization can be cared for in a home-like setting. Phyllis, again, on discharge from STEPS, is connected to the seniors outreach team and social work and the community health nursing team. So one important aspect of our primary care network in the community is that integration. We have now a social worker in each of the community practices, not one per, but at least every community practice has a social worker who is connected with them, who does that integration between all the different places that the patients have connections to. So in the last slide, back with her primary care provider, she continues to get longitudinal care. She's actually kind of gotten younger in that slide, but sorry. Benefiting from seamless communication that her provider has received from all the other teams that have been involved in her journey. So there we go, full circle.
Thanks, Mackie. What we want to highlight here is how much we value teamwork and collaboration within all aspects of the patient care journey. You at the center of all that we do. We know that being a patient in the healthcare system can be stressful, especially for those that have had previous traumatic experiences in their lives. Our philosophy is that any door is the right door, and that at any point in this example, any of the teams would link you to all the other services that you may require. We are highly integrated, as our area operational structure encompasses both acute and community, and our teams meet regularly to strategize and work out operational processes and discuss how we are continuing to drive up standards of quality through data-driven measures within all service sectors, including MHSU. I'll now pass over to Dana to walk you through that overview of the mental health substance use service sector and the services that are available to the people living within the region.
Thank you, Emma, and I'll just switch that just a little bit. You can hear me okay? And good afternoon, everyone, and thank you for allowing me this opportunity to share with all of you the suite of services available through mental health and substance use in the Cowichan Valley. The continuum of mental health and substance use services have seen unprecedented times as we emerge out of a dual pandemic and currently continue to be struggling in the toxic drug poisoning pandemic. We've heard Dr. Shannon Waters speak about it already, and I will add to that as we go through my presentation. Within the suite of services for individuals who require crisis interaction to longer-term case management, there are services available at Gibbons Road, right across the street from the CDH Hospital. And within those services, there's a rapid access and crisis clinic, case management and counseling services, addictions medicine counseling and medical practices, early psychosis intervention, and outpatient psychiatry services. Next slide, please. Our outreach services, the teams have increased in capacity over the past few years. Additions to the ACT teams that we already heard Kathy speak about, which are teams that provide care in the community to people who have severe and persistent mental health challenges that may require contact multiple times a day or a week in the community. These teams are complete with a wide range of skills from psychiatry services, nursing, social work, occupational therapy, and peers. We also have outreach teams with acronyms. We're very famous for our acronyms. And so the additional teams that we've added are, the acronym is SUIT, which is our Substance Use Intensive Outreach Teams, and our Integrated Outreach Response Teams. These teams are mobile outreach teams who focus on working with people who struggle with homelessness, addiction, isolation, poverty, food insecurity, and complex mental health and physical health concerns. These teams work with people on an as-needed basis, and they also work with people who are ready to be in a more case-managed manner. And we see up to 25 people per caseload in those situations, but our teams can be in contact with up to 85 people on any day. The supports for addiction and complex health care are provided where people are, whether it's in the community, in the hospital, in the emergency department, or any other areas. Peers are an integral part of our outreach team, and they provide lived and living experience to our care models and ways in which our service is delivered to ensure understanding, compassion, and what is needed has been invaluable to those we reach. Housing continues to be an area of need, and people can have all the outreach services available, but if they don't have anywhere to call home, it is very, very difficult to maintain any health or stability. We are working alongside our partners in BC Housing to continuously advocate for more housing options in the Cowichan Valley, with very significant successes as of late with the Village and Paddle Road. Very pleased to see those housing opportunities. So our outreach services, as I spoke about, the Substance Use Integrated Outreach Team focuses on overdose prevention. They follow up with people who are in hospital as a result of an overdose, and they also follow up at many of our community service partners, such as Lookout Housing Sites, Warmland Shelter, and the Overdose Prevention Site, the sobering and assessment beds, and they also make their visits to the emergency department. As you can see in this picture, our team wears orange jackets, and you'll often see them sporting the jackets and also carrying a backpack full of food, water, naloxone kits, and harm reduction supplies. They're highly visible. They can roam up to 5 kilometers at a time, connecting with community members, the business community, and other partners, such as our bylaw and our police. The incredible public health connection that was created and formed during our response to the COVID-19 pandemic was so successful that it continues today, and that partnership is invaluable between our services. Next slide. Looking to the future, CDH is so exciting as we add more beds and create a specific psychiatric intensive care unit for people experiencing acute mental health challenges. There has been careful consideration to ensuring the psychiatric area in all areas is embedded in culturally safe, trauma-informed, and client-centered care at the lens in which all space planning and design is undertaking. The additions to the inpatient unit going from the current state of 15 to 20 is going to be incredible. And with that, an eye on the future around recruitment. We need to recruit psychiatry services, which we have been so successful in the latest little bit here with 2 new full-time psychiatrists joining our team. The Wellness and Recovery Center. This is a service that opened up almost a year to the day. It offers a continuum of services from prevention, intervention, support, and recovery services. The first floor is the overdose prevention site. Lookout Health and Housing occupies the first floor and operates the overdose prevention site, while on the 3rd floor is home to our outreach teams. The co-location of services allows for a timely and seamless connection for people walking through the door. People are able to access the services offered at the OPS that include harm reduction supplies, information, safe injection booths, and inhalation options. We also have a TIOT clinic, which stands for Tablet Injectable Opiate Agonist Therapy. This is a Health Canada funded program that has been widely received in the Cowichan Valley, and thank you to the Cowichan Valley for supporting that application. Today, we see 25 people who have successfully enrolled and maintained on this program, allowing them freedom and health in different ways than they've ever experienced. So the OPS, Overdose Prevention Site, operates 7 days a week from 10 in the morning to 7 at night. The site, since opening, has seen an increased amount of attendance. So I did a scan, and over the previous 12 weeks, there's been, on average, 441 visits per week to the site for service. Program participants have reported finally feeling they can speak with a doctor without judgment. Some are now receiving other medications that they've been without for years. So for example, people who have needed medications for depression, anxiety, ADHD. They report improved sleeping, decrease in symptoms of dope sickness, and a feeling of excitement and gratitude at being a part of something new. Along the continuum of care, which we are so very fortunate in the Cowichan Valley to offer tertiary mental health and substance use services, and this is located at Cowichan Lodge on Zuhalem Road. There are 2 units that operate 24/7. The adult unit provides care to 27 individuals from the age of 19 plus who have needs that have been unable to be met within community services. And then we have the seniors unit, which is a very special unit that provides care to 24 individuals experiencing complex neurocognitive challenges such as complex dementia, Huntington's, and Alzheimer's. Both units provide specialty services with a robust staffing model, including psychiatry services, nursing, social work, OT, and primary care services. The services offered here are offered on a regional basis across Island Health. The continuum of services continues to grow, and we continue to grow with it, providing care to people who have historically not been able to receive care. And as we have highlighted the benefit of realizing the potential of being a full integrated area system where we can think together, share resources, and create services to match the life journeys of our community is paramount. We value these relationships immensely, and we would like to take the opportunity to play a video that captures the Collaborative Services Committee and the partnerships that it holds. Thank you.
I believe partnerships are effective if you have a common vision and commitment and really a passion to achieve that vision. And I think within Cowichan we have that secret sauce.
I think the power of our partnerships in Cowichan are based on relationship more than anything else.
We feel very fortunate about those relationships because we see things happen. You know, we see the fruits of that relationship.
I think there's a real recognition that together we're stronger, and while we each bring unique gifts to the table, that together we're able to achieve so much more.
I truly believe in strong partnerships because we cannot do it alone. We need strong partnerships to make improvements.
By having these really strong, trusted relationships and understanding of each other and a history, we now can do things that we were never able to do before.
And I think the last year or two, especially, we've seen the benefits of that collaboration and, you know, the battle with COVID, developing our primary care network in the community. We have a really strong partnership, so things are happening in Cowichan, right?
That's the power of Cowichan coming together to tackle big problems like primary care and hopefully paving a path for success in the future.
Partnerships were critical to our success, and really when we reflect on what we achieved, I think it's a model going forward.
I believe I've been fortunate to go to the tables representing our local areas of First Nations, and then to be able to speak to issues impacting our communities.
Those times really present us with an opportunity to learn and grow. And I think without challenge, there is no growth.
What happened in Cowichan in comparison to other communities is that the impact of how we responded to the pandemic was almost flawless because of the kind of partnerships that we had.
We've been very fortunate in our community with this collaboration.
It's really going to be an incredible future because we will have an opportunity to engage in discussions on what matters the most. and also the mechanisms to address the issues that need to be addressed in a quick way.
And I hope that we can continue to collaborate and come together to work on new ideas, new implementations, hear one another, hear our concerns.
We communicate every week, we're in touch with each other, we're driving the bus or the plane in the same direction. We know what we need, and we're finding ways to make things happen as a group.
I think we come from a place of humility and curiosity. And when we bring our partners together, that helps in collaboration to kind of form and storm ideas together for solutions.
I have nothing but hope that into the future we're going to get even stronger and achieve even more.
Well, thank you, Mackie, Emma, and Dana for that excellent presentation. We as a board and as an organization highly value our community partnerships. Thank you for coming today, and thank you for the great work you are doing in this community. I'm now going to open the floor to questions, and as you can see, we're a little bit behind, but we'll do our best here. Please keep your questions brief, 1 to 2 minutes, to provide the opportunity to get in as many questions as we can before we adjourn at 2:30. We also received some questions from the community via email, and I will ask those between your questions here in the room. I want to, though, before we start that, acknowledge that there are many people here who have helped us get to this meeting, and that is our multimedia team, who are doing the microphones and the cameras and the sound and all that, which is lovely. And our communications team, who have worked tirelessly to get us to this point and make sure that we tried our best to keep on time and ensure that people knew about our meeting today and so on. So thank you very much for that. I know there are people in the audience who are not from the Cowichan Valley, and I want to give the people from the Cowichan Valley the opportunity to ask the questions because we're here with you today. So I'm going to ask those of you who don't live here, who don't get health care here, to please hold your questions, and we'll figure out a way to get them answered for you after the meeting concludes. So let me open it to the floor. And I'm going to go back to the front table and use the microphone that's there. Oh, okay, great, thank you. Well, while people are thinking about their questions, then here's one that came from Paul Edwards, the president of the Chemainus Healthcare Foundation. How long will the service disruptions at the Chemainus Urgent Care Center continue? And Mackie, can I turn that question to you? Thanks.
Yeah, thanks for that question, and thanks for the intro, Leah. We recognize that it is really difficult for a community not to be able to access the urgent care center. It's such a key service in the community, so we really acknowledge that everyone's doing their best to try to keep the disruptions as short as possible. There's just been a number of unfortunate things that colluded to have us in this current situation. We're trying our best to recruit additional physicians. We have locums who have joined the crew here, and they've been really well received, and they've really been able to hit the ground running and taking up extra shifts. We've also had a nurse practitioner who's joined the family practice, so that will hopefully relieve some of the stress that are on the dedicated group of family physicians who've really been doing their best to keep things together at the family practice and doing their urgent care shifts. We've been working on cross-privileging, so that means there's sort of a complex steps that need to happen for a physician to be able to work in a site. So we've been trying to minimize those barriers and make sure that anyone who works at Ladysmith Urgent Care, for example, who would want to come and help out at Chemainus could, and vice versa, also with the physicians at Cowichan District Hospital. And in the meantime, as much as possible, because we're able to see when the uncovered shifts are, where they are, we are trying to communicate between the Chemainus and Ladysmith sites to make sure that patients can be seen in Ladysmith if Chemainus has to close for whatever reason. So I think the long and short of it is we're trying our best to cover those closures, so that cover the shifts so that the closures don't have to happen, and hoping that this is a temporary situation.
Thanks very much, Mackie. So I see a question, and here comes the mic.
Hi, my name is Diana, and I am very privileged to be able to have a family doctor. Feels like winning the lottery these days. But my mother-in-law, who moved here a year and a half ago from the interior, still has yet to find a physician or a nurse practitioner that would be able to assist her. She's elderly, she needs her prescriptions filled, she's got high blood pressure problems, and she is, I believe, suffering, her dementia is getting worse and worse. So she really needs to see someone, and I know you have plans to expand, but that doesn't help right now. And I'm sure there are a lot of other people in this room that have similar experiences. So is there any suggestions you may be able to give?
Thank you very much, Kathy. I'll turn it over to you, and ask someone else to answer the question if you want to.
I don't know, can you hear? Oh, you can now. Thank you for that, naming what so many of us are carrying right now is this concern of the gap today. And what we heard, so first of all, there is a database that we all should be registering in if we're looking for a family doctor called Health Connect. She's in there, good. So as long as she's in there, that's where these primary care networks are drawing their patients from. So they won't be able to attach to a primary care network that are being invested in unless they're in the Health Connect database. So that's the first step, is to be in Health Connect. I know we heard today about the increasing attachments that have occurred in Cowichan Valley. I don't know, Mackie, if you have that information. We heard it at the Ladysmith Health Center about attachments, but I do just need to acknowledge that this challenge of primary care is actually creating challenges throughout the whole health system. And it's happening in emergency. We see that in emergency departments. We're seeing that in terms of home care services, and we're seeing that in terms of people waiting for long-term care placements. And so it's a big problem. The Ministry of Health is working on some primary care initiatives. Some of you may have heard of the investments they made to new family doctors to practice longitudinal care. I think they announced today 54 family physicians across the province have taken up that initiative. And what that means is they've agreed to take on new patients. So that hopefully we'll see some more uptake of people being attached. The other thing that was recently announced was the extension of the scope of practice of pharmacists for people who are awaiting prescription renewal, because that's another big concern that people have if their prescriptions are running out. So as of October 14th, which is coming up, pharmacists will be able to renew prescriptions for conditions that haven't changed. So that will be a bit of a relief as well. But I don't know, Mackie, if you wanted to speak specifically to attachment rates here.
Yeah, thanks, and really appreciate your dilemma, Diane, and we hear this many, many, many times in a day. Health Connect registry, for those of you who didn't know about that, if you Google Cowichan Health Connect registry, you'll get to the number. And yes, I appreciate that it does sometimes feel like you're waiting a long time. But that is the mechanism to get on. Recruitment-wise, the Island Health Recruitment Department is doing their best to try to find new family physicians who can come to our area. I myself just went with the Island Health Recruiting Department to a national family physicians conference to try to see whether we can, spread the word about our beautiful area and attract people to this area. Certainly the new contracts make it more attractive to a certain type of family physician. We also just have the reality that we've got a group of very dedicated family physicians that have done their many decades of service in our community and who are retiring. What the primary care network has been able to do is when a clinic has is having difficulty in recruiting a family physician, they have been able in many instances to bring in a nurse practitioner into that clinic. So we are trying our best. We do recognize that it's a big problem. The number you were looking for, Kathy, was we have 3,000 people who've been attached to a primary care provider through the primary care network attachment clinic since it started.
Thank you. So I'm going to read another question that came via email. We've actually had a couple of questions asking about an update to the Cowichan District Hospital Replacement Project, which is actually where the board is heading after this meeting. So Wesley, can I get you to answer that? Thanks.
Okay. Super, thank you. And thank you all for allowing me to speak here today. So an update in terms of the overall hospital. We are still in the procurement phase, but we are very close to concluding that and we'll move into construction and design phase. The hospital is, to add to Dr. Shannon Waters' commentary earlier, the hospital is all electric. It is the first all electric hospital in Canada. We will not burn anything on our day-to-day running. So that will, from our sustainability goals, we will be adding to that. We'll be building 204 beds, which is an up from 56 beds. We are looking to get a shovel in the ground in early January of next year, with the conclusion of the construction phase likely to be late 2026. Any of you who have driven by Balmackinnon Road in the last 3 or 4 days, you would have seen that we are starting some work on site. We have been waiting for the birds to leave their trees so that we can start to fell some of those trees. So our ecologist has said that we're allowed to remove the trees, so we've started that work in earnest just to be ready and in good stead for our construction work taking place. We're also relocating some amphibians before they hibernate in November, so those are the activities that you may see on site. But we are working diligently to continue on that design phase with our proponents as we get and move forward.
You're going to earn your keep this afternoon. Thank you very much. That's great. Thanks. Is there a question over there? Thank you.
Yeah, thanks.
Do you want to just stand up? I can't see.
Sure. I'm Kathy. I live in Chemainus, and we're being advised not to go to our lab at our healthcare center in Chemainus, but to make an appointment at Life Labs in Ladysmith. And I was wondering, is that a situation that will continue, or it's...
Thank you for the question. We're just getting you an answer.
To this, or Emma, Marco, do you know the answer to this? We met them there today. The lab was working today. So we...
Hi, good afternoon, everyone. I'm Marco Pelhan. I'm the interim vice president for clinical services for Cowichan Valley and South Island. We are having some challenges with medical laboratory assistant staffing. So I will look into that specific question and provide further feedback. I know that one of the first things we've had to do is prioritize our laboratory samples from the urgent care center and from our inpatients at Cowichan District Hospital. So we've had to reduce and work with Life Labs. We've reduced some of our outpatient laboratory hours and diverting some of those to Life Labs. That is looking, we're seeing that just as a temporary resolution as we're onboarding new phlebotomists, but I'll find that out specifically as well. So thank you.
Thanks, Marco. I just have one more question here before I come to you, and then I think we're going to have to conclude our questions. So this question is that we have a couple related to Island Health and what they're doing to attract and support existing healthcare workers. Alice, can I get you to answer that?
Good afternoon, everyone. Perfect. Thank you for the question. And Mackie has spoken largely to this, and Kathy has also spoken about it. We are, like many jurisdictions, struggling with staffing, both physician and other providers. And we've been working on a number of different initiatives. Kathy mentioned the Regional Health Human Resources Sustainability Plan. We're actively involved in that work. Some specific examples Mackie has provided as it relates to physicians, in that she's been to Washington for recruitment fairs. We're looking at recruitment fairs for physicians. We're looking at how we can cross-credential so that our physicians can work between facilities, actively recruiting locums as well. And on the provider front, we've been doing similar things around looking at how we can utilize our staff between facilities, working with some of our other sites like Nanaimo, prioritizing how we can sustain our services, looking at incentives for staff, educational incentives, self-scheduling, and we've just recently hired an onboard assistant to help us with recruitment and retention. Those are just some of the examples, and we will continue to actively work on this. I think, as Kathy said as well, this is not going to be an overnight solution, but we feel very hopeful, and we have made some real headway over the last short while.
Thanks, Alice. Yeah, right here. Thank you.
My name's Jill. Sorry, and I live in town here. And I'm just, when you mentioned that portal, like our family doctor retired. So should we then be registering with that portal?
Yes, so.
You know, I mean, yeah.
Who can give the best information about the portal? Emma, can you give that information? That would be great. Do you want to come over here?
My partner's 79. He's been going to Chemainus Clinic since he was 16.
Right.
We have no family doctor.
Yes, so the Health Connect registry, and I don't have the number, but what we can do is perhaps provide a link for the number. So yes, you need to register on the Health Connect registry, and your name will go into the registry. And then what we're doing is we're working really hard through the primary care network and the attachment clinic to look at the people that are on the registry and to be able to attach them to people that are taking patients, and also the clinics that are having other providers come into their clinics. So as Mackie alluded to, the clinics that are having nurse practitioners come into their surgeries, we're building that capacity within those existing clinics to try and develop that skill mix so that we can create capacity more effectively within the community.
Thank you. Great. Thanks very much. That's perfect. Yeah, thanks a lot. So I'm getting the high sign, I think, that we're supposed to wrap up. And I want to, oh, Marco?
Sorry, I just wanted to provide clarity to the laboratory question. So the Ladysmith outpatient lab closed over the summer. We had a significant water leak there. We're hoping that with some renovations, extensive renovations, that we're going to be able to open that by the end of the calendar year. The Chemainus lab at the Chemainus Health Center remains open. And then for Ladysmith residents, we have Life Labs there as well, or you can come to the Chemainus Health Center for your outpatient laboratory services. So I just want to clarify, I hope that answers your question, and I can, I'll be in the back of the room if you have other questions to that. Thank you.
Great. Thanks, Marco. As a governance board, we are accountable to you, the people we serve in communities, and that is why it's so very important for us to have this opportunity to hear from you. I want to thank everyone who submitted questions or who stood up to ask a question. Thank you to Kathy, Dr. Waters, Dr. Ikamura, Emma James, and Dana, and Cindy and Vanessa for your presentations. It's very much appreciated that you took the time to come here today, and we hope that when we're back in this area, you will take the time again or tell your friends that there are ways for you to communicate with us. For those people who ask their questions by email, we'll find a way to get the answers back to them as well. And so now we'll close the forum. And once again, thank you for joining us today. It's very much appreciated.